In this chapter, you will learn how to develop an effective cognitive behavior therapy. An effective therapy often requires lots of preparation before the therapy section. Between the first meeting with the clients, the first evaluation section, and the first therapy section. Effective therapy requires one therapist to evaluate patient thoughtfully, accurately formulate the case, conceptualize the individual patient, plan out the treatment, and even if the patient had evaluated by another clinician, one therapist are required to do additional evaluation with data collection. There are lots to do rather than diagnose the patient's problem. In this video, you will first learn about the assessment process with the client. Then you are going to know the techniques of an effective assessment. At the end, you will learn what to do before the first therapy section and how to develop a treatment plan. Assessment is an important process in therapy. It is the way for therapists to get information from clients, understand their situation, make a clear diagnosis, and develop an effective treatment plan. Before the first therapy section, one therapist would go over the evaluation section with the clients to gather information. The evaluation section is different from therapy section. In evaluation session, therapists only gather information from clients and ask them questions, instead of helping clients to start solving their problems. Assessment is a time when therapists gather information from clients. However, it is not limited in the first section only. Each section goes on, therapists would gather more and more information and get to know more about the clients. Therapists should start gathering information before the first meetup. There are many ways for them to gather those informations. From the requests patients have sent, the report from the current and previous clinicians, and both mental and health professionals. Also, one should check physical condition of the clients because they could suffer an organic problem. Hypothyroidism can be mistaken for depression. There are different goals in the evaluation section. The goals of the section is to understand the client better. Also determine if the therapist is appropriate for the client in this case, and if the therapist is able to provide appropriate amount of therapy sessions when the client is needed. Decide whether the client needs any medication. Begin the therapeutic relationship with the client or their family members. Socialize the client into the structure process of therapy, and identify the presenting problem and develop goals. There are different ways for therapists to gather information. One example is asking patients how do they usually spend their time. This allows therapists to understand clients' daily life. Anything that client is interested in talking about could be useful in the future therapy sections. It could be the clues that allow one therapist to start a conversation and bond with clients. It also allows therapists to have an idea about the potential problem of clients. When clients are answering the questions, one therapist should pay attention into few points: their mood, how they usually interact with friends or family, how they function at home or work, how they spend their free time. Besides from asking what patients usually do, one therapist should also ask them what they do not like to do or avoid. It is important for therapists to understand what patients do not like to do or avoid, because it could be the potential problem one patient has. They might be trying to hide away from reality and not facing the truth. It could be a useful point bring up by the therapist in the future. Anything patients do could be the clue for one therapist to find out the real problem and solution. The evaluation section is important and time sensitive. There are limited of time for one therapist to get as much information as one could. It is important for therapists to interrupt patients properly and bring one back to the topic. For example, One therapist could say, "Sorry to the interrupt, but I need to know." This method allows therapists to keep up the progress of the assessment with the client. In between the evaluation section and the first therapy section, therapists should use conceptualization to make a treatment plan. Also, they could request the patient's report from their previous and current mental health professionals. Then summarize up the data collected from the evaluation section, then use conceptualization to develop an effective treatment plan. When you get towards the end of the evaluation session, it is the time for therapists to wrap up the assessment process. Since it is just an initial contact with the client, it is a good idea to ask if there is anything they would like to share. Besides from asking what they would like to share, therapists should also ask if there is anything they would reluctant to share. Also, if their family members came along, one therapist could ask the clients if they would like to invite their family members to come into the therapy session. Therapists should explain to the client that it takes time to come up with a diagnosis for them. Telling the seriousness of the client's problem could be both useful and not useful, depends on the case. It would be better for therapists to summarize the client's problem and symptoms the client is facing. Letting the clients who set their goals would be helpful developing the treatment plan. One therapist could put up a piece of paper and ask the clients to write down their goals. Therapists should also clearly explain to the clients what one client should expect the therapy be like. Give patients a general idea of how much time it takes throughout the therapy session. Overall, it is important for therapists to get to know about the clients, setting goals and a treatment plans to develop an effective treatment before the therapy session starts. There are many ways for therapists to get information from clients. Through their conversation, clients, peers, clinicians, and the form they fill in. Evaluation section and treatment plan itself do not make up an effective therapy. However, therapists have to make a most accurate diagnosis and plan out an effective treatment plan. It is important to make least mistake as possible in the beginning of the therapy. If one therapist falsely diagnosed a patient's problem, it could be a waste of time of patients and possible to harm them. Since the most important rule for therapists is to do no harms. An ethical therapist should spend extra time doing research on clients, especially the one who is culturally diverse because they have different customs and social rules.